remote meeting. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's June 16, 2021 revised order extending remote participation by all members in any meeting of a public body, this meeting of the Great Barrington Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the town's website at townofgb.org. For this meeting, members of the public who wish to listen to the meeting may do so in the following manner. See instructions at the top of the agenda. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. With that being said, we will take a roll call to officially start the meeting. Peter Stanton?
Aye.
Ruby Chang?
Aye.
And I vote present too, Michael Anu. The meeting's called to order. We have one question that we're going to address from one of our attendees. Rebecca, if you can, Dina Fisher, you have talking period. Just unmute yourself and ask your question.
So my question is about what you just read.
Yes.
And it came up at the last meeting. This has become not an open meeting. We don't know who's attending. I'm even reluctant to speak and certainly give my personal address when I don't even know who's at the meeting. As far as I understand the open meeting law, it allows for Zoom, but you need to know who's present, who the participants are. And at the last meeting, some people got to speak in person where you saw them, some did not. There's someone on this screen now, I don't know who he is, yet we have no idea who else is there. So I really question the webinar approach for a public meeting.
Okay. Rebecca, do you want to answer just the why we're doing webinar as opposed to the Zoom that we've done in the past?
Sure. We'll have to get back to you on how webinars are compliant with open meeting law. But the Board of Health is doing this meeting in a webinar format because we had been doing regular Zoom meeting formats. People were able to just unmute themselves and launch in, and the Board of Health wanted a little bit more control over participation as they would in a regular in-person meeting. So in a regular in-person meeting, you need to come up to the podium, state your name and address, and only once given permission by the chair does that participant speak. With a regular Zoom meeting format, it's really just chaos, and there's none of that order that you would see in an in-person meeting. So a webinar gives the Board of Health a little bit more parameters and sticking to what it would be like to be in an in-person meeting.
We're also not the only board who uses this format. Am I correct in that understanding?
That's right. So I think it was the policy either came from the town manager or the select board, one of the two. I believe it was the select board, but I could be wrong. They've requested that all boards and committees going forward use the webinar format. So I believe we are consistent with all other boards and committees.
Can I just respond on two technical things? I run Zoom meetings all the time. You can mute people where they cannot unmute themselves, but you still see them, and you can control. In fact, it's much easier to control speaking because you create what they call a stack, so that people have to put their name in the chat and stack, and then you call on them, and you only unmute them when you choose to. In this format, I saw you last time. You were kind of running around the screen trying to find out who to call next. I know someone who was one of the first people on, and he was the last person to speak. maybe there's a way to do webinars. I'm not a webinar expert, but I do know what you just said, Rebecca, about regular Zoom is just not true. So I understand, listen, between that and the crazy people you probably get, I can understand wanting to have control. But on the other hand, it's very off-putting. I mean, you heard a few other people say that too. I don't even know who's here. Why should I tell people my home address when I don't even see them? I mean, when I first moved here, which is pushing 2 years, people had to identify themselves. Even now, even before you did this, people were being strange about giving their address, and I thought it was a requirement by local law. So in any case, I mean, you've got this now, but I would really like to. You say it's the select board, not the town manager, to contact.
I don't want to throw the select board under the bus, but let me get back to you, Dina, to see where the policy came from. But regardless, I think the Board of Health made the decision outside of the policy coming from the town manager or the select board.
Okay,
to
could you
stick
at
with
least set up?
But I'll just,
Yeah,
Michael, if it's okay with you, I just want to clarify one other thing that
Sure.
Dina said. So stating the name and address, I sympathize that that's pretty uncomfortable, but there's really no difference in doing that here than there is in a town meeting, which is upwards of 300 participants, or even a heavily attended select board meeting where there could be 50 participants. You don't know everybody in that room. You might recognize some people, but you don't know everybody in that room, and you still have to state your name and address.
yeah, I give you that. You're absolutely right. The question is, could you enforce it then so that everybody has to? There were some really oddballs on that last meeting who would not give you their address for anything. And I don't think they should be allowed to speak if that's the rule. So that at least would be one. The second thing is if you could talk to your tech person about how webinar could be set up so people can answer. One of the ways, by the way, is you could set up a separate chat that only Rebecca you see, and then people at least in order. That would be my only request. I understand the problems of running Zoom stuff. It's a pain in the neck, but it just felt very strange to me anyway.
Yes, Dina, as hands go up during our public comment time, they stack up on the participant list that I see. So I call on them in the order that I've been watching that the past few meetings, and they come in, they all line up.
Okay, I'll buy it.
But we are going to go over a few more ground rules and stick more to them this meeting.
Can I ask how many people are on right now? Because we don't even see that. That's usual.
Sure, there are 20 attendees at the moment.
Okay.
All right, thank you. I believe we can start with our first agenda item, which is health department updates.
Okay, I'll keep it brief, but I just wanted to tell you two things since we met last Thursday. This week's report for active COVID cases in Great Barrington is 111 active cases. That's 15 to 16 additional cases than we saw last week. So continuing to climb in Great Barrington alone. And then also the Southern Berkshire Public Health Collaborative has been organizing pop-up testing clinics to kind of bridge this gap in testing. People aren't able to always get an antigen at-home test kit from the pharmacy, and then sometimes scheduling a PCR appointment can be days to a week out. So Southern Berkshire Public Health Collaborative has set up some new dates for January, and those dates in that schedule, it's on the health department website, and I believe it went on the town's Facebook page this afternoon. So along with the schedule, there's a link to Sign Up Genius. That's how you register for an appointment.
Okay.
And sorry, one thing, I think I said this on Thursday, but these pop-up clinics are using antigen tests as opposed to PCR tests. So antigen tests are most effective if you are physically symptomatic in that very moment, because they're good at telling you if you're shedding live virus at that time. They are effective if you're asymptomatic, but they're really an important tool when you are sick.
Thank
And
you.
is everyone still comfortable with using these antigen tests? I know they were looked at as being very promising. Is that people still having the same favorable opinion, or? And Ruby, maybe you have a little bit of insight on that.
The problem with a lot of these testing is that you have to do it correctly and you have to have enough viral particles for it to test up. So if you test 2 days ago, your viral particles may not be enough, so then you have to test again. So you could test negative and actually test positive the next day.
No,
And again, so there are some thoughts about doing home testing. You have to be very vigilant with getting, you don't want to do it too lightly in the nostril because you may not catch anything. So there are some people have a lot of hairs in their nose, and so then you're brushing against the hair. You're not really brushing against the skin, which is where you would get the viral particles. And so some people do recommend doing the back of the throat first and then doing the nasal swab. They seem to find that could move up the positive rate 1 or 2 days earlier. However, they're grappling with how to instruct public on how to do that, and they don't want people to hurt themselves, so they don't know what they're doing. So that's a dilemma, but there are studies out there that find that the throat and nose method is a bit better.
I see. All right.
I'll have to ask the proctors of the pop-up clinic. They're nurses, they're registered nurses. I know there are volunteers there, but I'll have to ask them, Ruby, if they're taking swabs from the throat as opposed to the nose, since we're seeing with
So they're doing
Omicron.
both. Yeah. So that comes from studies from Johns Hopkins, where they're doing epidemiological studies on these testing.
Okay, great. Thank you, Ruby, for that insight.
Thank you.
Is that it for our department updates?
Yes.
Okay. Then we will move on to our headline event tonight, which is our letter that we are intending to compose in response to the school committee's letter, which they sent us. Rebecca, you sent us all out a draft that basically was, from your recollection and looking at from our last meeting, included thoughts and comments that we made. We've all seen that. I've made edits. I'm sure you, Peter and Ruby, have edits that you have in mind. Peter suggested we start with the original draft and then go from there. I'm not opposed to that.
Okay. I will share my screen. Can you see that?
Yes.
Okay. So this is the draft that I sent that hopefully captures the discussion that we had, that you had, keep saying we, on Thursday. And then here are some amendments that Michael sent. So if you want to start here, we can do that, and can just jump right in.
So I have a question concerning whether Peter had requested us specifically using the word mandate. I don't recall his letters stating that, and I may be wrong, so I just wanted to know.
Yes, from my recollection, they were not asking for a mandate in that language. They were asking for us to add it to the list of recommended, that we adopt that policy. So in effect, it would, my feeling was that it would act as a mandate, but that language, I don't believe he ever wrote that language to us specifically, which is why made some of the edits in the first paragraph that I did to change
Okay.
mandating to requiring.
Gotcha.
Which
I was
correct,
pretty sure that he had written it was a request for a mandate, and then that would effectively add the COVID vaccine to the rest of the childhood vaccines.
Okay.
But I also think that in terms of for our purposes, that whole first paragraph is really just a reflection of the request and not a statement on our part.
yes.
So I feel
Right.
like I'm comfortable with it sitting the way it is because it's really not our language. It's just an introduction.
Right.
So I would see the edits for us being after that. I'm thinking that there's, the areas that we seem to be pretty clear are where that we're not interested in doing a mandate and or recommending that. And so it seems like if we pay attention to that as we go, we're asking people, instead of us saying that vaccines are the way to go, we're asking people to consult with their primary care doctors or pediatricians for their children and make that decision together. So it seems like we can take out any language that suggests that we're heading in that direction. And the two areas where I saw that are starting with the Board of Health recognizes. That's okay until it says however. And if we took out from however to the end of that sentence, we would take out the language that that has us advocating for the vaccine, as opposed to what I think we want to do, which is advocate for people to work with their doctors to make these decisions. That was the first area. Then the next sentence, it says in conclusion, and I think if we took out from after the word children, and it just says eligible for COVID-19 vaccine, become fully vaccinated as soon as possible if we took all that out and left that recommends that parents of school-age children in conjunction with medical experts decide or just determine what is the best way to keep their child or children safe. That seems like it gets at what we want and takes out any suggestion that we're pushing one way or the other. I could send you this if it's easier than trying to edit on the fly.
I understand what you're saying. So just scratch that.
So are you guys interested in producing like some statements about why we are recommending vaccinations?
Are we blanketly recommending? I guess that's
No.
the big rub.
I don't think the common ground between all three of us is comfortable with recommending vaccinations. So I think what we're recommending is that people take action and work with their pediatricians to make the decisions for their child or children. So I don't think we would be able to make that kind of statement and all be on the same page.
Right. What I'm trying to say is that giving some recognition to where we are and why this is important. Like giving some statistics as far as things that we already know that we don't need to agree upon. In light of the fact that we have rising cases, in light of the fact that throughout the country there has been increased admissions to hospitals for children who have COVID. But you kind of have to paint a picture of what's happening now as a reason, or not a reason, but as a staging for why this is so important right now.
It makes sense to me. I think that we could add a couple things back if that makes sense, or if you have suggestions. But I think maybe we want to push forward a little bit further on making sure that what's here is comfortable for everybody, and then and then see what else we might want to add.
Ruby, did you have a chance to look at my edited version, the second paragraph in particular?
I can go back and look at it again.
I have it here. I'll just scroll down. Is that okay, Michael?
That's fine. Yeah.
This is the edited draft. So the second paragraph, you stated.
You have, Rebecca, do you have the version without the red and black in the striking part?
Yep. Hold on 1 second.
But I think the part with the striking in the red is probably the easiest to understand what's going on now.
I had sent her a document that had both top page and bottom page. But
Right.
maybe, yeah. I mean, I'm fine. It sounds like, if we keep the original first paragraph, which reflects if use of the word mandate is more reflective of what the school committee was actually saying, then that maybe we can keep that in there. I guess to me it was more the second paragraph where I knew we were going to hash out particularly what we wanted to say or did not want to say.
Yep.
Okay. So again, this is the original version. This is a version that doesn't have the red and the strike throughs. It's just might read easier. But these are the edits that Michael made that are all in here.
Oh, okay. So this is the one without all the strike throughs.
Yes, but this is
It reflects the edited. It's just easier to read without.
Can you scroll up?
I think we'd probably
think
need to go through it line by line.
Yeah, I think the part about informed consent, as well as going through the risk and benefits, are redundant because they're the same thing. Because that's what we do, is we go through the risk and benefits of anything that we do. So we could combine that into one sentence. And I didn't quite understand about alternative treatment, possible alternative treatments. So vaccines are not really a treatment. They're preventative measures. So, so you're talking about what happens if you catch COVID and what can be done about it. Is that what you're saying as far as that sentence?
Well, I guess that there's a lot of discussion around that point. So I was
Right. So that's not. I think that talking about, what if I do get COVID? What are my choices of treatment? That's something that is not in the general context of this, but certainly I would just say be aware of any treatment options, which would include all treatments. Does that make sense? So it's
I think
the alternative treatment sounds like you have traditional treatments and then alternative treatments.
well,
Is that
there
right?
are those in certain places who are advocating for the position that's out there. I'm not saying I'm adherent of it or not, but for the sake of argument, there are those who are saying if you do not get a COVID vaccine, that you should have a plan for early treatment. So my intent was to say that if a parent is considering vaccination, they should be made aware of all risks and benefits, and that the conversation should be: are there alternatives? Are there not? Different physicians have different ideas about that. It was
Right.
just more. It was more to acknowledge that there are medical professionals who are advocating for an early treatment protocol in lieu of if someone elects not to get vaccinated. That's my understanding of the argument. It doesn't necessarily mean that we're advocating for that. And in theory, a conversation could go along the lines of: here are the risks and benefits of the vaccine. I, as such and such doctor, do not believe there are any alternative treatments that you could do. Therefore, something along those lines. It's more to bring greater awareness to that there is a dissenting opinion out there.
Right.
But-
So I think that's fine. But what I'm saying is that I wouldn't use the word alternative as opposed to, you're thinking of alternative as an alternative to the vaccine. Is that right?
Yes.
Okay. So different people have different interpretation of alternative treatments. So in the medical profession, when we think about alternative treatments, we're thinking about things outside of, the traditional tried and true, researched medical treatments. So there's different meaning to it, and I think it's a great idea that you're saying that parents should explore all treatment options if the child has COVID. I mean, that's fine, but I wouldn't use the word alternative because it could be interpreted differently.
Okay. Do you have a suggestion of a better wording there?
The options.
Right. Or just any possible or any other options would be fine.
So I just want to put a word in here for keeping our focus.
Yes.
In that the letter is a response to the school,
To the vaccine.
specific to the vaccine. And I think that there's all kinds of interesting statements or things that we could bring into the conversation. But I think probably in terms of being productive and getting this thing to a complete place tonight, if we stick to, it makes sense to me that we would stick to answering the letter and the idea around the mandate and not let it get too complicated.
I hear what you're saying. I feel that if I guess in my mind, we are doing that by it seemed from our last meeting that we were all heading in the same direction of that we were not in favor of a mandate or of adding these to a list of required vaccinations for school. That was my impression. I'm not
Yes.
saying right. So my intent in writing down those thoughts was to give a broader perspective of that it's trying to recognize and acknowledge the bigger picture, because that was my where I was thinking, where I was going there.
Yep.
And if you feel that it's
it's fine. I think if we're going to be productive, my suggestion is we go through the edited version where we can see the edits, and just accept them one by one.
Okay.
Incorporate them one by one or not.
Okay. Let's do that.
I'm just taking a moment to put the exact wording of the superintendent's request at the top of this page so you can look at it as you go through these edits. It'll just take me two more minutes.
Can you just scroll up down a tiny bit, or then you can't see what you're doing?
Hold on 1 second. I have to enlarge it anyway.
No, they use required anyway.
Okay, whoops. I don't know what happened here. It kind of got cut off. But can you read that?
Yes.
Okay, so that's the essence of the school committee's request to the Board of Health.
Okay.
So am I right in understanding that as the more characteristic of a requirement rather than mandate language, or is that just splitting hairs?
Oh, you're right.
I think requirement is pretty much the same as mandate.
Well, I guess maybe we should use requirements since that's the language they use.
Okay, so
So let's go
You-
down to
right here.
Michael's.
This we're starting here. Okay.
Yeah, but I'd just like start at the first cross out and just go one by one.
Okay. Whoops.
So if his language was requiring, that's great. Then just we can accept that first edit.
Which
The mandating and requiring, just take out mandating.
all right, so I'll just take it out as we're
Yeah, yeah.
fine with just simplifying that sentence.
Sure.
The Board of Health recommends, sure. I think education and is good. I think we could accept that.
Okay.
If Ruby and Michael agree.
And then the next edit was immediately seek education and advice from a medical professional. This version is gathering puts emphasis on gathering more than just one opinion. And
Yes, that was my intent there.
I would take out preferably their child's pediatrician because many people see family practice and many people see nurse practitioners and they're all really knowledgeable. So I would just keep it at medical professionals.
as opposed to preferably their child's primary
I would just-
care provider.
Yeah, I would
Okay.
just take that out. Yeah. Great.
So I think the rest of that sentence is fine.
Can you just add to determine their child's level of risk, and do you mean COVID risk or risk of the vaccines?
Risk. Yes, that is the implied thing. We could add that there. List risk in regard to COVID, since that's what we're specifically. I felt that was implied, but we can spell that out more specifically.
Because when I read it, it almost seems like the risk of vaccinations.
Which is part of the conversation.
In order to determine their child's level of,
If my intent was, I think if you put COVID-19,
how about just like,
that
yeah, how about their child's health risk? Just health risk.
health risk in regard to COVID-19?
No, just health risk.
Okay.
To both, it could be both.
And I guess the whole thing is about COVID.
Right. In order to determine their child's health risk and most appropriate course of action. With transmission of COVID-19 as pervasive as it is currently, I totally agree with that. I just saw many cases today.
What about striking and other illnesses? I was thinking, you had talked about flu A, Ruby, on Thursday, being prevalent, and I don't know if it's currently, if you're seeing it a lot, but in November and October, I know cases of RSV were pretty high too. So anyway, but I had this in the draft because you were talking about flu and flu A being.
Yeah, I think we could just take that out.
Okay.
Because we're talking about COVID-19. Transmission of COVID-19 as pervasive as it is currently is. I would cross out the time is now. We urge parents of school-age children to consider this matter as soon as possible. As soon as possible. That's fine.
Yep. Leave it.
Yeah. Peter, are you good?
Yep.
Okay. The Board of Health recognizes the importance of informed consent. Therefore, in regards to COVID-19 vaccine, it is important that all parents of school-age children understand the risks and benefits. So, it's kind of redundant because informed consent is risk and benefits. So,
Well, I feel like a lot of people are not necessarily aware of what informed consent is. That's kind of why I took the time to spell it out. I mean, in a lot of conversations I've had, people have that's been a frequent topic of conversation.
Okay.
So that's the part about the alternative treatment and ability to make decisions without compulsion. I'm just not sure that is part of what we're talking about.
Well, part of why I put that in there was I felt that it was reflective of many comments that we heard and some which I would make of people not feeling pressured by either an entity such as a school to push them towards that direction.
So the issue is that we're talking about bananas and apples. We're talking about vaccinations, also comparing it with other treatments. So treatments means, like prophylactic treatments, as well as treatments after you get it. But that's not part of what we're talking about. So as part of the conversation, I'm sure that most parents will say, well, if my kid gets it, what is out there? Is there antibiotics that's available or whatever? So I would not put the part about the compulsion and made aware of possible alternative treatments. That would be part of that conversation, I would think. I don't know. What do you guys think?
Well, my sentiment is that there's enough from conversations, both personal and I mean this is anecdotal, of course. My experiences. There's a lot of there's enormous pressure being applied from both sides of what has become entrenched positions, and I mean families are divided, generations are divided. And I feel like there's just that real pressure to move one way or other, depending on what your own echo chamber is saying.
Right.
So I was trying to capture that idea that people All right, I mean, and we can also have to entertain the realm of possibility where, one physician or medical professional says one thing, another says another, and there's pressure there, but maybe this isn't the best language to capture that idea, that sentiment that I've heard out there.
Why don't we
If you
consider
could- right. Yeah,
a period after vaccination and decide if we are good with that previous sentence, because that gets into the risk and benefits of vaccination period. And then we can treat this separately.
Okay.
I appreciate Michael's thoughts about that. I was wondering if we could put in something about those conversations should also include present day knowledge or recommended available treatment options. How's that sound?
Yeah, so let's already start by replacing the word alternative and doing treatment options, just because that seems like a key thing that we can probably then all agree on. Just the word alternative.
Just strike alternative.
Yeah,
Yeah.
and then put in treatment options so we're still making sense.
Okay.
Or just say and made aware of treatment options and leave it at that.
Michael, how strongly do you feel about the last phrase about the decision without compulsion?
But I think I don't think we necessarily have to have that in there. It's something that's been on my mind because of, as I mentioned, there's of the dynamics that are going on, certainly in our community and nationally. But that for the purposes of this letter, I don't think it's critical per se that that's included in there. I'm happy with the other what we've said in the previous two lines. So
Yeah.
Okay.
I kind of, it's appealing, but then I also feel like there's no way to avoid it. Everybody's feeling, the pressure from all sides already.
I guess I was wondering and maybe this is where I'm at, but maybe not you guys, is the kind of paying this idea that, these types of medical decisions, maybe it goes back to that whole, our opposition. Maybe it's more of my articulation of my opposition to mandates in this particular case. But that's why I'm not opposed to necessarily striking that from this letter.
Ruby, where are you at with the sentence as it is now?
I think that are made aware of treatment options and leave it at that. I think the sentence about making decisions without compulsion is very endearing and very understandable, because I think so many parents go through this. I like it. I think it really gives us a sense of what parents are going through right now. So if you could put it in some way that shows that we understand that, I think it's good. I would just cross out the alternative portion part.
So why don't we move forward with this sentence as it is right now? It says treatment options, the alternative is gone.
Yeah,
And then we can,
and have the ability to make decisions without compulsion, I think is fine. No, don't cross that out.
yep. She's probably
Just cross
turning
out alternative. Yeah. And have that's fine with me.
I have a question.
Yeah.
So, Ruby, I'm understanding what you're saying about we're talking about apples and oranges, because vaccines are preventative tools and treatment is something that occurs after one is inflicted with the disease. So I want to make I want to make sure that this reads in one subject. Like you're just articulating one thing: prevention or treatment.
It would be nice to put it in two separate sentences. So we're talking about prevention, and then we're talking about, also understanding if your child gets COVID, what are your options is important, because that should definitely be part of the conversation. But it's not absolutely necessary, because it doesn't really, it's not what the school's asking for. I'm not giving you good. I'm not giving you good. Peter, help out here.
Yeah, I think I think we're back to, should we separate that sentence where end it with a period at the end of vaccination?
Okay, I just added this in. Do you want me to keep it back? Do you want me to keep it like this, or do you want it back to the Board of Health recognizes the importance of informed consent, period? I added in regards to preventative measures to put in a distinction between preventative tools and then treatment options.
No, I like that.
I think that's
good.
fine. Yep.
Yep, I like that. Therefore, in regards to COVID-19 vaccinations, you could take that out.
Take this out?
Yeah. You could take out, however. It is important for all parents of school-age children to understand
Risks and benefits of vaccination. If we're really going to keep the thoughts clear, then I still think we need to put a period after vaccination and figure out how to begin the next sentence.
Yeah.
Because it's an also thing. It's not the same thing.
Right. It's different. I would put in understanding treatment options after infection may help in
The ability to.
in the ability of making decisions without compulsion. After infection may help. Yeah, how does that look?
I think it's clearer and we should move on.
Okay. Did you want to put in the part about proper mask usage?
The reason I struck that was because I feel like our advisory that we have
Yeah,
is kind of a known thing, and
yeah,
for the purposes of this letter, I
yeah.
didn't know if we needed to go into that since it's kind of overlapping, but that was just something I mean, we've been stressing this advisory that we have for a while, and since we're being asked specifically about vaccination, I figured maybe we didn't need to branch off to mention this, but I know it came up at our last meeting, certainly.
I think I'm fine with the second line and not repeating the vaccine and preventing illness and death, I think, but I'm not sure about the opportunity to refresh in people's mind the staying home if sick.
You'd like to see that maybe put back in there?
I think so. I think there's
Okay.
Yeah.
Well,
the way
I'm not opposed to it. It was more of just trying to be more concise, but I'm certainly not opposed to talking about public health measures.
we could
Should I
refer
move-
to the advisory.
What was
Say that
that?
again? Say that again, Rebecca? You had a question?
Again, just making sure it flows. If you want to leave in the bit about preventative measures, which that's what public health means, but I could say public health preventative measures. Do you want to move that up in between? The Board of Health recognizes the importance of informed consent in regards to preventative measures,
Such as
or
I think you should leave
something
it
else.
where. I think it's fine to leave it where it is because it's a different thing.
Right. I think we kind of need to also emphasize public health measures such as are part of the whole conversation. It is still very important to do all of those things. And we shouldn't put it on the side and just focus on vaccinations.
Okay, so you all agree to take out, however, the COVID-19 vaccination is the best preventative measure we have to prevent serious illness and death. Are we
Yep.
taking that out completely
I think so.
or moving
Yes.
it somewhere else? Okay.
I would take it out.
All right. So give me some suggestions on how to reword this. Or where would you like to begin with rewording that?
You could say something like the Board of Health continues to emphasize. Or something to that effect. Emphasize the importance. How about continues to emphasize, or how about just the Board of Health emphasizes continuing public health measures such as.
What did you say, Michael? Sorry.
Instead of continues to emphasize, say emphasize. The Board of Health emphasizes continuing public health measures such as, like you have. I'm not
Or
sure.
continued efforts. The Board
Sure.
of Health emphasizes the continued efforts to implement. Right. And just take out are all effective. And put a period on the end. Okay.
This process must be painful for writers to watch.
Yes.
I know my grammar is not great. So sorry for all the editors in attendance.
Group writing is always rough.
We need Eileen here to do this.
She
Okay.
is here. Should we let her talk?
Let's finish the concepts,
Yes.
Okay.
that last paragraph.
In conclusion, Board of Health recommends school-age children receive medical treatments in form of I would just write receive COVID-19 vaccination upon determination of their legal guardians. I wouldn't put in medical treatment in there. Receive COVID-19 vaccine. As per, do you want to put COVID-19 vaccine as per CDC guidelines because it's constantly changing?
Well, I think it's more of a big picture concept that we're talking
Oh,
about. there.
okay.
But
Okay.
I feel we don't
Do you want to
necessarily-
keep strongly in there or no?
No.
We need to emphasize some sort of a time. It's a critical element right now. So this doesn't have as much emphasize. I think the main reason it's really important right now is because of what is happening. And so I would like to emphasize somehow that these conversations should be made as soon as you can, as soon as possible.
Did we not do
Rather
that
than-
up above when we explicitly said that? We urge parents of school-age children to consider this matter as soon as possible. You want to say that more
No.
strongly?
No, I think that's good. So in conclusion, I feel like we need to put something in a time, how about in a timely manner? Receive vaccination upon determination of their, in a timely manner.
I'm just wondering if we need this whole paragraph.
I think
If
so.
we need to do an in conclusion, it's already brief.
I would like to see that. 'Cause
Then
I think
Then
I don't mean to cut you off. Go ahead.
yeah, go ahead.
I was just going to say it kind of sums up our bigger picture and is kind of a response to the desire to have a. To me, I felt it was important to say that because we were being asked to consider adding a requirement, and so I feel like this kind of answers that very succinctly.
I guess I'm surprised after we're choosing not to make a mandate and we're choosing not to out and out, recommend vaccines where it seems like this isn't actually a conclusion of what we just wrote. What we just wrote has more to do with recommending that people seek guidance from medical professionals.
Right. I think that you're right. It felt a little bit off. Recommend school-age children. Recommend.
Do we need to add something to tip the hat to what we mentioned above?
And we're really, it's a
Or
recommendation to the parents.
So the question I have is for the board is that, are you recommending vaccinations or are you recommending that parents make their decisions as soon as possible?
Yeah.
They're two separate
That's the
things.
latter, yes.
Yes.
Do they make their decisions?
Yeah.
Okay. So that's the case. That's what we should put. Does that sound right?
Yes.
Okay.
Maybe it's a parents / legal guardians.
Yeah, I put that in there. I didn't know if we need. It was just. It's more of a. Maybe we just say parents. Is that if you guys are comfortable with that? We don't have to have.
Depends how inclusive we want to be.
Yes, that was
I was
kind
just
of.
going to say, I think parents, legal guardians, or caregivers.
I think that's good.
Yep.
Well, caregivers don't have the
Make
legal
that kind of decision.
right to make decisions. It's only legal guardians and parents.
Right.
That's good. Okay.
Do we want to say regarding COVID-19 prevention as soon as possible? That was just a question. But
I think vaccination is the main thing we're being asked to. I think vaccination should stay in there because that's kind of the main thing that we are being asked to consider. The main
right,
objectives. I think vaccination is more reflective of what we're talking
you're right.
about.
I agree.
That's fine.
Yep,
Okay.
I think it's good.
I left this in here as read because I wasn't sure if you were finished talking about this sentence. Is this, you're comfortable with how this reads?
There's a little bit of redundancy there, but I think it's fine to leave it and turn it into black. But I don't know that we need to start it with therefore.
I think that's fine.
There's an extra in front of medical professionals in that second line of that paragraph, up a little bit from your cursor. There's an A there. I don't think should be there. Advice from. It says medical professionals, but it says a medical professionals. You just need to get rid of that. Yeah.
And can you add a to? The Board of Health recommends that parents who have not already done so to immediately seek education advice. And instead of who, I'll write if not already having done so.
If not having already done so.
Yeah, not having already done so. Not already having done so. Yeah, that's fine. To immediately seek education advice in order to manage child's health risks, the most appropriate course of action. That's fine.
So at least 3 times we've urged them to do something as soon as possible.
I don't know if it's pervasive or is it rampant. Pervasive seems like in the background. What do you guys think?
I mean,
Yeah,
Rampant does describe something that's spreading without control,
yes.
it is.
and
It
pervasive
is spreading without
is-
control. There is no control. People are
Yeah.
like, they're just unbelievable, and people are not sure where they get it from. It's just like it is rampant right now.
Yeah, I think that's a better word than pervasive.
Sure.
I think just I don't know. It's not part of this, but it just this disease has caused so much stress with parents, unbelievable pressure. It's unbelievable how emotionally draining this thing has been to parents.
Here we are adding pressure. make a decision as soon as possible.
No, all I'm saying is that let other people help you make those decisions, because I do feel that when I try to talk it through, I think it eases their tension if they could just talk it through, and then they can make their own decisions. You know what I mean? It's sometimes you just have all these thoughts in your head and you just have such a hard time, figuring out what's right, what's wrong. I read this, I read that. And sometimes you need someone to just kind of sit there and say, here's the data, this is what I'm seeing, this is what's going on. And so they could figure out, they could kind of like make a chart of what's good and what's not good. And I think that would take away a lot of the stress of thinking that something bad's going to come around the corner any moment, and and feeling totally helpless.
I think it's good where it is now.
Okay.
All right. Do we want to begin the comment period before we vote on this?
I liked what Ruby said, like let medical professionals help you make that decision. Is that worth adding in somewhere?
I think we covered that when we seeking advice from medical professionals. And to me, that would mean that.
Okay. Should I leave this up as you take comments?
I believe we
Sure.
should. Okay. As per our rules, we will take comment on any item that we vote on. So we'll begin that. So please raise your hands, or if you would like to address this letter that we're talking about. I'd like to keep the conversation to this letter. We've heard in our past 2 regular meetings lots of comments from all over, and we've also received a lot of feedback from our last meetings, and I appreciate all that. So for tonight, I'd like to keep any comments to this particular advisory, and I'd ask that people would state their name and address, and we want to prioritize those in Great Barrington or those who have children in the school system that we received a letter from. I'd also like to say that any questions you have for the board, unless the board member feels inclined to answer them, we will provide an answer at a subsequent meeting. I don't want to get into a situation where our board members are being cross-examined. We appreciate every and all questions, but again, unless the board member feels inclined to do so, we'll take that question and seek to answer it at our next meeting. So without further ado,
2 minutes.
I see Dina Fisher's hand up. Dina, if you want to begin, I'll enable you to.
Okay.
Okay.
As painful as this was for you, I'm having a hard time figuring out what you left in and what you took out. But so stop me. There was this phrase that says,
could you just your name?
I'm
and
sorry.
address?
I'm Dana Fisher. I live at 84 Cottage Street in Great Barrington.
Thank you, ma'am.
Okay. So did you take out the phrase medical treatment in the form of COVID-19 vaccination?
Can you see the screen that we?
I can. I had you were taking and removing. I think it's gone, but it was medical treatment is not vaccination, and it shouldn't be there. But I think you took it out.
Yeah, we separated that.
Okay, so it's not in there anymore because vaccination has nothing to do with medical treatment at all. You also had a phrase, and I think I'm wrong about this too, if not the best method. You took that out too. It is the best method. It's the only method of prevention. So did you take out any reference to it being a method of prevention? Because I think that's a mistake.
We wanted to leave that between people and their medical providers, I think.
But, well, all right. So then that sort of leads me to, and did you take out the risk of death phrase? This is a non-conversation. I think you did. But what I'm hoping the health department would do is talk about the risk not only to the community by not being vaccinated, but by the community to the child who's not vaccinated. I don't think that's an unreasonable thing to include. After all, you're a health department, and that is one of the reasons that children should be vaccinated, because it's a risk to the child not to be vaccinated and a risk to the community. It's the old, I'm really disturbed that you took out, we recommend, how did you end it with? You recommend, you had recommend vaccination and you took that out, which I'm very disturbed about. And honestly, my only one final thing to say is you're risking having people come to you to have all childhood vaccines removed. Why not? If you're not willing to require this vaccine, why do you require measles, mumps, polio, rubella, et cetera, et cetera? So that's my comment.
Thank you, Dina. Mr. Haynes will enable you to talk, and then you have, just state your name and address, please, sir. Once you can now unmute yourself and begin.
Yes, Mr. Haynes, 220 North Plain Road, Great Barrington. I have a question. The previous speaker is speaking to your letter and finding fault with it. So apparently the forum is open for discussion about the letter. Is that correct?
Yes, could you rephrase your question? We are talking about this letter. We're taking comments on this
Right,
letter.
it's on the letter. Okay,
Yes.
So then it may be appropriate before you vote on the letter for me to read into the record a letter concerning the letter, if you don't mind. I'll take under 3 minutes.
Okay.
This was written by some concerned citizens in Great Barrington. Dear Great Barrington Board of Health, we understand from your January 6th, 2022 meeting that the BHRSD has requested a letter supporting their masking mandates and proposed vaccination mandate. We strongly disagree with any such act. As you are aware, concerned citizens of Great Barrington have previously provided the Board of Health with peer-reviewed medical studies, in addition to data from the CDC's VAERS website, which indicate the dangers inherent with masking and COVID-19 mRNA injections.
I'm sorry to interrupt. This isn't about what we're talking about, and this isn't about the letter. This letter has nothing to do with mask mandates. Can we keep it on track?
Yes, I believe that masking was in, well, it'll become clear. I will strike the word masking. I'll just keep it to the vaccinations.
I really want to suggest, Chairman, that people speak to the letter.
Okay.
And speak and not just read a letter to us that is general. We could be here all night.
I thought that I agreed to take less than 3 minutes of the board's time.
Okay, it doesn't feel like it's about the letter.
I mean,
Michael, you're on mute if you're trying to say something.
You gave a forum to someone who really wants you to tell everybody to vaccinate all the children. Okay, so a citizen has had an opportunity to try to modify your letter that way. And I, as a citizen, want to have an opportunity to modify your letter by suggesting that you not send it at this time, and with good reason. So I would hope that you'd be willing to entertain those concerns.
Can you just concisely say what you want to say?
I guess that perhaps some people on the board, and unfortunately this letter went out late, so you may not have read it.
I have seen it, Mr. Haynes, just so you know.
We've
I
all
think
read it.
we all have seen it.
So I'll just read a relevant paragraph. We are aware that the school committee is under financial pressure to take actions to conform with CARES Act requirements. It's our understanding that DHRSD has and will continue to receive substantial federal funds through 2022. A total of $1,407,394 in 2021 and $2,044,529 in grant money for 2022. These grants have strings attached. One must ask the question, is this request from the school committee, is this request fueled by a desire to protect the welfare of our children or because of financial incentives? That's the basis of our concern. Also, it seems totally unreasonable that this school committee would come to you with this request without providing any backup information justifying their request. What scientific studies have they provided you to back up their request for this letter? I've seen nothing. So I want to thank you for the opportunity to share this with the board.
Thank you, sir. Is there anyone else from our community who would like to speak to the contents of this letter that we're looking at tonight? I see
A.L. Baumgart.
yes, Baumgart. We'll allow you to talk. Please state your name and address for the record. JL, you're unmuted. You can talk if you're able to do so.
Can you hear me?
Yep.
Yes, name and address, please.
Okay. Hi, Lisa Baumgart. I live in Cheshire, and I have two sons that attend Monument Mountain.
Okay, thank you.
You're welcome. I was just had a quick question as Board of Health members. Do you feel that it might be important as a preventive measure to mention education on improved diet and lifestyle as a preventive measure, especially since those most at risk for COVID have multiple comorbidities? I mean, I don't hear anything ever mentioned on education around diet and lifestyle. And it's very frustrating to me that this isn't even mentioned in your letter. And I just wanted to throw it out there.
Okay.
Can I answer that?
Yes, of course, Ruby.
Okay, so dietary changes as well as advice could take me a good half an hour to an hour to go over with each individual child. This is not something that we can do right away and make a change in our public health. So yes, those are all risk factors associated with COVID infection, which could have worsening of outcome. Yes, I would really like to try as a public health member to change our American diets, but it's an uphill battle, and it is very, very difficult.
I think
So-
diet and lifestyle are a life and death risk.
They are, but they're not
And-
in the scope of this particular letter. I totally agree with you. There are many risk factors associated with COVID that you can have worsening of your symptoms as well as worsening outcomes. However, at this point, it is beyond the scope of what we can do at a moment's notice. It's something that takes years of work.
If I might add, Ruby, that doesn't mean that we aren't encouraging people to take control of their health through change in lifestyle. We of course are. We have talked about this at other meetings. We do. That is something as at least my impression was we do share that sentiment. But as you said, for the purposes of this letter, for what we're directly responding to.
Thank you very much for listening. I think the simple, if this letter is to even go through, which I do have many concerns about it that have already been addressed by Mr. Haynes, and the other woman that spoke. But I think that a simple statement on diet and lifestyle is a very important thing to consider with prevention is all that's needed, regarding the diet and lifestyle topic. Just a very simple statement that, this is part of the prevention measure.
Okay.
Thank you.
Yep, thank you for your comments. David is next. Name and address, sir, and you just need to unmute yourself.
Michael, I didn't actually see a hand raised for David. Did you? I could have missed it.
I thought I did, but maybe we haven't. All right.
Redbird.
Yes, Redbird, then you're next in line. Just unmute yourself and you may begin.
Cardinal Stockbridge. I just had a question. What is a couple of questions. What is the urgency to getting this letter out so quickly is one question. Is there a deadline?
I believe that our intent is to, since we've had a letter from the school committee for well over a month, and in the face of our case counts, which are higher than they've ever been, we feel that we want to respond to the school as quickly as we can so that they have our answer.
Okay, and then the case counts, has it really been made clear how many of those cases are whatever particular variant they can possibly even test for with the PCR test? Are we really clear on how many of those cases are really COVID, Omicron, et cetera, whether they are in those with comorbidities? And, I think those things need to be clarified before we get on this fear thing with there are X amount of cases and they're growing every day. And yet, even Walensky has admitted, and Fauci too, I think recently publicly, that a lot of the cases that they are calling COVID cases are actually not necessarily COVID cases. They might have tested positive, they're in the hospital, et cetera, et cetera. So I think clarity, needs to happen before we get too afraid about how many cases there are. And then I also want to just reiterate that I do believe the preventative measures, something needs to be in there about that, because there is never a downside to reminding parents that it's important to provide a decent diet for your children, maybe even, vitamin C, vitamin D, zinc, these things that are all very known to help either as prophylactics or treatment even of COVID. So you can't, I know, say that you recommend a certain vitamin, but the diet is really important. And then I would just recommend that you stress the informed consent, that you get a little more clear on what that is in the letter, because from what I've seen, informed consent is a big issue here. Most people are not getting it at all, actually, when they go to get their vaccines. And even from their doctors, I have to say, they're not being given all the information. So that's pretty much what I'll say, except to also thank you for trying really hard to word this in such a way where you are not necessarily, because I know you are also not all on the same page about this, right? So you're trying to really work well together, and I appreciate that very much. And also you are not strictly saying mandate and the vaccine is the only way to go, because it isn't, and especially for children, and we know that, and there's a lot of data to back that up. So I'll keep it at that so other people can speak. Thank you so much for your work.
Thank you.
Should I answer one aspect of that question in terms of the cases in Great Barrington?
Sure.
Okay, so this question has come up a lot, especially now that people can get antigen tests over the counter, and more and more people just using antigen tests. So the state's reporting, and also what we see in our public health disease surveillance database, are confirmed positives. So the number I gave at our last meeting and the number that I gave at the start of our meeting, so Great Barrington has 111 active COVID cases. So that's confirmed cases. So that is with a PCR test. You have to take a PCR test for the confirmed case to be confirmed. So I just wanted to clarify that because it does get confusing, I think.
Okay, yes, that's helpful. Is there anyone else from our community or who has kids in the school system who would like to comment on this letter tonight? Okay, Kathy Regan, you're up next. Oh. Talking is permitted. You just name and address and off you go.
Hi. Actually, this is going to be Kevin Regan. He's using my account, but Kevin Regan, and it's Housatonic.
Yes, hi. In discussion regarding the criteria that's going to be in this letter, you referred several times to the CD recommendation guidelines, but did you take into consideration the fact that Walensky from the CDC actually stated that the shot, because it isn't a vaccine, does not stop getting COVID or stop the spread of it?
Is that a question you're asking specifically, or is
Yes,
it?
I'm asking specifically because you did mention the CDC guidelines throughout this discussion, and I was wondering if you actually considered that the head of the CDC said that these shots do not spread or stop you from getting it, because that should be considered. That doesn't stop infection or transmission. She actually said that in the news conference. So I think that should be considered instead of just what the CDC says.
I think, thank you for the comment, and this letter doesn't refer to CDC.
I know, but you did, what I said first was, you mentioned the CDC guidelines when you were developing this letter in this conversation. And my question was, did you consider that she said that when you were developing this letter?
Yeah, I
So
believe that.
let me answer that.
Go ahead, Ruby.
We well know that vaccinations does not prevent infection. We know that. However, vaccinations has been shown through studies that it helps to prevent multi-systemic inflammatory syndrome. This is well known. And we also know that it prevents the spread because it shortens the duration of illness. These are things we do know.
Why did Walensky say
that? Is what, excuse me, and that is what I have in my mind as the undertone for these letters that are drafted.
Okay. Do you have any further comments, Kevin? Or questions you'd like to state for us to consider?
I don't think so. You didn't answer my question.
Well, I think Peter said that, and I'll reiterate too, that that comment did come up in our conversation, but we haven't referenced anything in the letter in regards to the CDC guidelines. And I think that's attest to it in writing.
That's still a fact, whether you put it in the letter or not. And you said you based this on the CDC guidelines, and that is one of the CDC guidelines. You actually said that. So you didn't consider that at all, yes or no? That's my point. I
don't believe we necessarily based this letter on CDC guidelines. I think the comment was made of what the guidelines might be, but I believe this letter reflects our opinion. As we all have, as it's been mentioned before, we see certain things differently. And I believe that we've all taken multiple sources into consideration. And so this letter is a reflection of our feeling at this time.
Wonderful. Thank you.
Thank you. Is there anyone else who would like to speak from our community? I see JL's hand up. Did we hear from them already?
Once. Yep.
Well, seeing no other hands up, I think we can hear from them again if we can keep it brief to just a couple minutes. You're enabled. You're unmuted. Just state your name and address again for the record. And
Okay, it's Lisa Baumgart again, and it's going to be in Cheshire. Very quickly,
yes,
this is regarding Rebecca's comment on the PCR. I don't know if you guys are aware, but the CDC did withdraw the PCR process as a valid test to detect and identify SARS-CoV-2 as of December 31st, 2021. On their website, they state, quote, "The PCR panel was first introduced in February 2022 for detection of SARS-CoV-2 only." They further state CDC now encourages laboratories to consider adoption of multiplexed methods that can facilitate detection and differentiation of SARS-CoV-2 and influenza viruses, end quote. This clearly explains the disappearance of flu cases in 2020, and I don't think we can really use this as a measure when you're forming this letter of really what's going on. You know, as somebody previously mentioned, a case is not somebody that just tests positive. That is not an active case. They're not. They should be actively sick. And I think this is an important quote from the CDC and just something for you guys to consider. And that was all. I didn't mean to take up more time. And I appreciate how you guys are working, trying to work well together.
okay. Thank you. Appreciate your comments. Any other hands from our community or for those who have kids in the school? Not?
Yep. You've got it.
Yes, I see one. Yep. Tristiana.
Hello, my name's Anna. I live in Great Barrington. I'm just calling because I am really, really happy and incredibly grateful that you guys are not mandating these mRNA gene therapy drugs, because I do have a kid in the system, and you know, I personally know like it's very stressful for people who do not choose pharmaceuticals as their main you know, pathway to health. It's very stressful to think that your child could be deprived of their right to education, to think that this shot makes it or breaks it. So I'm really grateful you guys are not into mandating this. And I also wanted to say, I live in Great Barrington, and I know a bunch of people who have been injured by the by various brands of this drug. My hairdresser, she has 2 kids at Monument. She has pericarditis. She took only one shot. Then my other friend, she actually, well, I'm not going to tell you. She owns a business in Great Barrington, but her mother had the shot. She had a stroke. The mother had a stroke, and then she was learning how to walk and speak again. My other friend, her mother got Bell's palsy from it. And my other friend's brother, who's in his late 60s, early 70s, he got a blood clot. And then he had a heart attack, and he can never drive again from the shot. And this was like earlier on when they were first coming out. And then another guy who was a kid in the Steiner community, which is, I'm part of the Steiner community. He was at the not this Waldorf school, but another school. He was a graduate. He was around 21. He got the shot earlier on. And his mother sent out a plea to the Waldorf community because he was in line. He needed a heart transplant because he had heart damage from it. This was way back when the first shots first started coming out. So anyway, I just wanted to say I'm really appreciative of you guys all working together and supporting people to make their own informed health decisions, which I think is what it's about. I think that's all I have to say. Thanks a lot.
Great. Thank you for your comments. Kathy, I see your hand up again. I'm assuming you are going to speak now. So we'll get you enabled. And you know the drill.
Hi, can everyone hear me?
We can.
Okay, I have a question tonight. I wanted to find out exactly where this letter is going to be displayed. Like, what was the exact intent? Why was this letter requested by the school? Where is it going to be displayed? How's it going to be used? I mean, I don't think that was ever discussed completely. Is it to, in a sense, it sounded like from what was talked about before, it was to actually push the vaccines. Is it about fulfilling the grant deliverables for the vast amount of COVID money? We looked that over in detail. We know there are deliverables. They do need to actually actively push the use of vaccines and masking and social distancing and all those things as a grant deliverable to be able to get this money, which does seem like a conflict of interest and inappropriate. So, you know, that my basic question is, how is this letter going to be used specifically?
Well, I can attempt to answer that from my my understanding is that this is a reply to a request that we got, and it's basically our answer to their request. And how they choose to use it, I don't know. But it's what we're doing is trying to fulfill our duty to respond to their request.
Do all requests have to be responded to or replied to? I mean, don't you need to know the reason to decide whether it's appropriate or inappropriate to honor a request?
I think in theory, you could say that perhaps we don't have to reply to every request, but I think we're all in agreement that this letter needed to be answered in some fashion, and I think that's what we've attempted to do in spite of our various opinions on various aspects of all things related to COVID.
So in other words, we would need to speak with the school directly to find out what their intent is. Is that what you're saying?
I would think that's a good suggestion, yes.
Thank you, Michael.
Yep, thank you, Kathy. Anyone else would like to speak about this letter? I don't see any other hands. I'll give it just a little bit longer. Not seeing anyone else from Great Barrington or anyone else who has kids in our school district. Do you, Peter, Ruby, want to make any additional edits, or are we still happy with that? With that, everything as written?
I think that there was some the first comments that Gina had made were things that we could just review quickly and see what we felt like was there and what isn't there, or did we want to follow through with? I don't. I understand that this is that COVID and vaccinations and kids and that there is an effect on community. I don't know if that needs to be stated in this letter, but it, that's just felt like something to bring back up and review. If there was anything we wanted to add related to, prevention, as a benefit, not just to the individuals and the school students, but also to the community.
And I guess for my thinking at this moment is I like kind of that we were trying to respond to what exactly the school board requested. So while we could certainly add many things into this letter, I feel like its brevity and our attempt to be as concise and stay on track with answering their requests is reflected fairly well. But I mean, there's many things we could say. We could elaborate on many points.
Yep.
I don't know if that would be necessarily helpful in our primary intent, which is to give them a response.
Right. So if there was I'm on board and I'm fine. I'm just gonna poke it a little bit more.
Okay.
If we were going to have a required, versus mandate, if we were going to have a required scenario, one of the reasons that we would want that is actually more importantly probably for the community than it is for the individual child. Just to put that out there as a concept.
I mean, that could start us down the road and open up that can of worms if we wanted to do that.
Yeah, no, what I'm saying though is that I think that may actually be more on target with the intent of the request.
You'd like to see additional language that addresses that specifically?
I think that part of this conversation, we could also put in wording that these recommendations are in line with public health. Public health needs with a balance between individual rights and health of the community.
Yeah, I like that.
Right? You like that?
Yep.
So we could say this is in line with our goal to balance the rights of individuals to the health of the general public.
Now I just need to make it a sentence.
I was just thinking to myself, it's really a lesson for our children on what is civic duty to a certain extent and what is individual rights.
You could get rid of with a balance and just put balancing individual rights with I can't see the next line on the next page, but
I forgot what you had said, Ruby. Balancing individual
Oh.
with
public health.
with the needs of the community,
Yes.
or with protecting the community.
Yes, that's fine. Oh, I would just write the needs of the community. Or you could just write the common good. Actually, I think with the needs of the community is better. It's more
Specific.
sorry. Yeah.
In a general way, I think her other comments are actually still covered in there, and I think everybody already knows the risks the outcomes that we've been experiencing related to COVID. So I think that was probably the thing that stuck out to me as the most important thing to get back in there.
Okay.
I see, I don't know if you want to open it back up to comment, but I do see one hand raised from someone who we haven't heard from before.
Yes, I think since we've made some further edits, it's only fair that we hear from someone we haven't heard from before. Absolutely. Is that Lisa that you see? Okay. Lisa, go ahead. Just need your name and address, please.
I muted Lisa just because of that feedback. So,
Lisa, is there a way you can? We got really bad feedback there. Dina, I do see your hand up. We've heard from you a bunch tonight, but I'll entertain one last further comment since we have made one further revision. If you could keep it very brief, it would be much appreciated.
Did I unmute?
You are. Yeah.
Just a question. Who was the fifth person on the screen? Because I thought it was only board people that were going to be viewing.
I believe you're referring to Ned. He is our one of our health inspectors. He's taking minutes for the meeting.
Oh, okay. I'm sorry. I just didn't know. And I want to thank you actually, and Peter in particular. I was going to offer a suggestion instead of the needs of the community, the benefit to the community might be a better word. But in general, I think this is great. And then finally, Ruby, not here and not now. I would love to get a response to some of the issues I raised about vaccination in general that I wrote to you guys.
From Ruby specifically?
Yeah, because she's a pediatrician and she made a very strong case at the last meeting for vaccinations, and I'm making a very strong case for this being one of those. And I'd love to hear more offline why she couldn't possibly consider the mandate. That's it. But again, don't discuss it now. It's too late and it's not important.
Okay. Thank you for your comment.
Okay, thank you.
I'll wait just a few seconds more for any other hands to pop up if anyone wants to weigh in. But we can talk while we do that. So are we now set with this letter?
I think we are.
Okay, Lisa, we'll try you one more time. But if there's bad feedback, we can't even hear what you're saying.
Okay, hopefully it works this time.
Marginally better. Rebecca, did you mute that or did she?
I think the participant muted.
Okay. You want to give it one last shot, Lisa?
Try it one more time. Thank you.
Oh, it's really, unfortunately, it's really strong. Are you still there, or did we lose you completely?
I am here. If I'm unmuted, I don't. But it's
I just muted Lisa in order to say that feedback often happens when two people in the same room are both on the same Zoom. So, or if you have two devices that are listening to this Zoom, if you can get rid of that feedback by muting one of them and then talking into the other.
Just simply muting one of them?
Mm-hmm.
Okay. All right, Lisa, if you hear that, that's reflective of your situation. We'll give you
another new name came up.
Yes. Well, we'll give you a minute, Lisa, to see if you can solve that problem, and we'll just jump ahead. I see someone with a screen name Clowney. I'm hoping it's someone from our community who has a child in the school. If you could please state your name and address before you begin speaking. You are unmuted.
Can everybody hear me?
Yes, we can hear you. Name and address, please.
Hi, I'm George Steinberg. I'm on Prospect Street. And I'd just like to say that some of the wording here, the first thing I wanted to address was the very last sentence on that page, the balancing individual rights with the needs of the community. I feel like that's that could be a slippery slope, because there are different people that see where the line is between individual rights and community right and needs of the community. And it's very easy to push that too far into something like collectivism or even communism. So I did want to make that a point. And the other point I wanted to make was up at the top, that first paragraph, a policy made by the Board of Health. No, I'm sorry, it was the middle paragraph. With transmission of COVID-19, yeah, right there, as rampant as it currently is. There's contention as to how rampant things are, and I feel that that's a really strong word that pushes parents and teachers. It introduces bias into the letter, which I don't think is the intention of the letter. I feel that it's as I know you guys are trying to be very neutral, and I just feel that that word probably isn't appropriate for that. That's all I had to say. Thank you.
Okay, thank you. All right, Lisa, let's give it one last shot. You just need to unmute yourself. Yep. Unfortunately, we can't hear from you because we literally can't hear you. I hate when that happens. It's one of the frustrating things about remote meeting is that at least speaking for myself, I'm looking forward to us all returning to in-person meetings in the future. It'll be very good to actually see people face to face.
I'm wondering if we're at a good place to close the public hearing.
Well, actually, we're not in a public hearing, so we could decide to vote.
Forum.
Or, I mean, I see two other hands up. We did edit, so I'd like to extend just a minute to each person who's there, literally 1 minute, since we did make an edit. And then if we see no other hands, then no other new hands, then we'll move on to a vote, if that's okay with you guys?
Yes.
I'm okay with that.
Okay. Kathy, one final comment.
Okay, very quickly, I agree with the original woman about the format for the meeting. If we could possibly use the Zoom with muting people, we understand that, but at least so that we can have the chat, we really hope that that can be possible in the future. The other thing I wanted to say that we do agree with the last gentleman that spoke. I forgot where he was from in Great Barrington, but it feels like socialism in that last paragraph. So I think that's really inappropriate. We'd love for that to be fixed. And we also agree what he said about rampant. There's different interpretations of that. So we vote that that word is dropped. Thank you.
All right, thank you, Kathy. Cardinal, we'll get you enabled and we can hear one final comment from you.
Okay, can you hear me?
We can.
Okay, thank you. And there again, the two people who spoke before me were already on what I was going to say. So the rampant instigates fear. We have enough of that going around, right? So I think a different word there would be really helpful to the community. I can't believe I'm using that word. No, but in general, just, let's not scare people any more than they need to be scared. And then the needs of the community, I have big issues with that, mainly that it really does sort of push, you're saying this great thing of, balancing individual rights, but then you're ending it with the needs of the community, which implies that the needs of the community are very different from individual rights. And I do agree, it's that slippery slope of socialism. We got to be careful there. So if there's any way you can take that out, maybe reframe that sentence somehow, that would be, I think, a lot less divisive in a way, even. I hate to say it. Sorry, you guys are doing great. Thank you.
Thank you, Cardinal. I hear the comments about it at the last sentence. I'm kind of neutral about it. I feel like it's neither here, that it doesn't offend me, it doesn't thrill me. But I do wonder if there was a more concise word we could use instead of rampant. I do.
Well, I mean, at the times when we were really concerned in the community, there was 10 cases in Great Barrington, and there's 111 is what I just heard. How is that not something that we should be sharing? That's 10 times as many cases as some of the worst times during the pandemic.
I agree. What if we use the word like widespread, reflecting that it's because, like, I've even comments from Ruby saying, people are getting it, they don't even know where. Just putting that out there for. I mean, that's widespread seems to be a term I hear higher up officials use. But that's my.
I'm open to finding another word. I don't think that widespread is. That's to me that's a reality. It's it's worldwide. The reality is that the cases are really high right here, right now, in the school district that we're talking about.
What if we use spreading unchecked? Would that capture the?
I don't know how that's any less fear inducing.
We could use the surge because that's used all over the media because it is a surge.
I guess I'm concerned that we're not trying to instill fear. I don't think that sentence is something that is some kind of statement that that is even about that. I think it seems more like just a reflection of the current situation. It's not like we're creating something that doesn't exist. And it's already it's already out there. So I guess I'm just wondering how far we want to go looking for words when we're in the situation we're in. I guess I'm not seeing it as inaccurate.
I have to agree with Peter. I think that if you want to use a less fearful word, I guess it's could be taken as threatening or scary. But what we are dealing with is a surge. It's higher than we've ever had before. I personally, I'm scared. I'm scared because of what I'm seeing. So this is 35 years of treating children. This is unbelievable. So if anybody's scared, I'm scared. Okay, I'm the first to say that.
Here's
So,
my recommendation
but
for
I'm
language.
not there to produce fear. My job is to calm and have logical conversations. So if that is, so we could just write with surging COVID-19 cases currently. Would you rather have that?
Well, with the current surge of transmission of COVID-19, then we can get rid of rampant.
So would we say with transmission of COVID-19 surging in our community?
You could do that. I think that's equally good, or with the current surge, and that's probably better.
Okay.
And then, is
You
there
don't
any?
need to put transmission. You could just say with COVID-19 surging in our community. That's fine. How's
Okay.
that? Okay.
I'm not necessarily opposed. I feel like it's a fair compromise.
And then, is there anything about the last sentence that we want to revisit?
So we could just leave out balancing individual rights with the need of community and just write this is in line with the goals of Great Barrington Board of Health and leave it at that.
Okay. Okay.
I think it's a shame to lose that last phrase. I'm fine going forward, and because it seems to be the simplify things. But I do think it said something about the decision that people are put in and the pressures. It did get at that, but I'm fine just cutting that off.
Yeah, I feel bad about it too, because I really think that it is a hard decision for family, but it's also understanding what is happening in your community around you. It's both. I don't know how that's associated with socialism, but
Rebecca, I see your physical hand raised.
Yes. Maybe it's, I don't mean to interject, but I hear that was a strong point. And I just want to say that the role of the Board of Health is to protect the community. I think that's the essence of your job, is to think of community needs. So I just wanted to say that as a reminder that, you're going into through a lot of trouble, like wordsmithing and finding the right balance of appropriate language. But
Yeah, I'm not necessarily. I'm kind of neutral on it. It didn't offend me. It doesn't thrill me. I do like. I think I echo your comments, Rebecca. That is part of our job, and it is the constant challenge we face on every issue, whether it's glyphosate or whether it's late fees, what have you. We're constantly doing that. It's just this issue. There's the implication and the stakes are much greater. So, I'm fine with it being there. I'm fine with it not being there. So, are we good with it as it is, or do we want to stick it back on the end? I mean,
I think I'm good with where it is right now.
okay.
Yep.
I'm fine with that too.
Peter?
Yep, I'm fine.
Okay.
I think
All
I'm
right.
good.
Assuming there's no grammatical things we're missing, obvious. The content and the letter we're agreed on it. So I believe that we should, I'll look for a motion to send this letter to the school committee.
I make a motion to send a letter to the school committee.
I second.
I'm in agreement. We'll take a roll call vote. Peter Stanton,
Aye.
Ruby Chang,
Aye.
and I vote aye as well, Michael New. Okay, very good. Thank you guys. It's always a tough process to edit in real time. Let's move on to the public health advisory. Another easy, light subject. Do you have anything you want to say about it, Rebecca, before we?
no, this is just one of those agenda items that back in June, when the state of emergency was rescinded, you request be a recurring agenda item. So in December, we had 2 meetings to revise the current public health advisory. So if you'd like to do so tonight, it's on the agenda for you to do so.
One thought that's been on my mind for a number of days now is we're starting to hear and see messaging about differentiation of masks, and there seems to be a narrative taking shape that's starting to kind of come out more strongly in favor of actually people are starting to talk more about well-fitting masks or N95 masks, and starting to see more and more comments. As the messaging goes, it's not always very consistent or very helpful, but I'm wondering what you guys think about that. If we need to, I mean, the N95 situation, they're readily available for people to purchase, and it's not the same situation that we were presented with way back at the beginning, where there was really nothing. Without getting into all the implications of that, I guess my basic question is, do you guys feel the need to add anything about recommending or encouraging people to, get a higher quality mask? I mean, you still see everything from gaiters to N95 out there. So I guess my question is might be a little bit more pointed to you, Ruby, but it's certainly for all of us to weigh in on. It's just been on my mind thinking about it.
So the recommendation from what studies have shown is that the Omicron is so it's so highly infectious that the N95s are a better choice, or the KN95s. If you don't have that, to double mask using a cloth mask and a surgical mask. The problem with a surgical mask which I have one here, is the problem is that the edges are not completely enclosed right here. So the sides are not, so what happens is that you're still breathing, allowing free air to get into your nose. So if you put on a cloth mask over that, it will protect and take out the areas that is open to air that is coming in as you breathe. So it kind of encloses this. And then the N95 mask is definitely very tight. I have a hard time talking when I'm having it on, which I wear it all day long now. And so it's difficult. You actually have to take multiple breaths as you're talking because it's really hard to breathe, but it does protect you. And so I think that, you know, a lot of, I think you have to go by what the CDC says as far as evidence-based and what the recommendations are. And that I think there's been changes, but I don't know if it's going to be long lasting. So that's all I have to say. I think at this point, urging correct masking is probably the best that we could say.
Okay.
Some people do feel that the masks are very expensive. And,
They aren't cheap. It's true.
yeah, they're not. And you have to throw them out and get new ones, so forth. So it's not something that's readily attainable by everyone. With public health, we're hoping that maybe we'll get some funding for that in the future. But at this point, I think double masking may be an option since the surgical masks are relatively cheaper.
Okay. So do we want to have some language that speaks to that in our, so I guess the general question is, do we want to update our advisory to reflect that, or do we want to just keep our advisory as is? And
It currently says, related to masks, it says wear a medical grade, which could be the surgical mask that we just saw isn't totally there. N95 mask when indoors and or around immune compromised individuals. It seems like
I think that's
strengthening there.
The new quarantine guidance recommends that if you don't complete a 10-day quarantine at home in isolation, and you finish out the 5 days of quarantine, you have to wear a tight-fitting mask. So it doesn't specify N95 or double mask. It just says tight-fitting, as Ruby was illustrating, can be done with a surgical and a cloth mask or a KN95.
Right. So we could change the, I thought the medical grade or the N95 mask is still good. Or you could just write in addition tight fitting or tight fitting mask, which may include double masking.
I'm stopping the screen share for a minute. I'm going to pull up a Word document of the advisory so we can add in things as we're talking about them.
Can I just share something with you guys while she's doing this?
of course.
This is from the official journal of the American Academy of Pediatrics. And they had an article stating vaccine exemptions and the risk of continued disease outbreaks. And here it says, given the unprecedented level of COVID-19 vaccine hesitancy and refusal that emerged across many regions of the United States, efforts to bolster our public health systems for immunization vigilance should be strongly considered, similar to well-tested and successful national pharmacovigilance mechanisms that are already in place, such as the Vaccine Safety Data Link. It's a collaborative project between the CDC and 9 healthcare organizations. And so what they're saying is that we also have to consider when there are clusters of vaccine exemptions, you are going to see transmissible viruses. And so it's another public health issue. And I don't know that is socialism or not. It is the facts that poorly vaccinated areas, you're going to see emergence of disease. I don't think that's a personal personal feeling. It's very logical. It's printed. It's from a reputable agency that has guided pediatrics for generations. So I think that a lot of places, it is a public health issue. So that's all I have.
Okay. Rebecca, do you have that document?
Can you see it?
Yes.
Okay, so I added in tight-fitting medical grade or N95 mask.
Or double masking.
Do you want to just specify? Do you want to just say tight-fitting mask?
Well, I think you can leave what we have, and then it sounded like Ruby mentioned, advising people to double mask if they can't meet that criteria. Am I understanding that suggestion of yours, Ruby?
Yeah, so the reason you do double fitting is because it's tighter. So I think tight fitting is reasonable. You could put in parentheses double masking if you want, because many people don't really understand what tight fitting really is.
Correct. For some, anything on their face is tight fitting, as is evidenced by the not insignificant number of people who I see wear a mask below their nose. I do tend to see that more often than you would think. It's certainly not everywhere, but I do often notice it, and I'll leave it there.
Yeah. I still see people wear masks that has this little, maybe Michael, you could help me with that. It's a mask, but it has like a little plastic, like a valve to it. You know what those are?
I think they're a valve. I mean, I think they make them N95s with those. At least in the construction industry, we've always been familiar with the N95s with the little vent. So I think it just allows you to exhale easier. So it's I think my understanding is it gives you protection of an N95, but it doesn't necessarily give those around you N95 protection because you're venting out. So
right.
My sister, who's expecting any day now, they've been very strict in their cocooning themselves off from the world for the past 2 months. And my brother-in-law wears one of those in certain situations where he's unable to. I believe some places have actual specific guidance of where those are allowed or where they're not.
I see.
Because of that very reason, because you're breathing, your exhale breath is directly venting into the space outside your mask as opposed to being filtered. But that's just my understanding from the top of my head.
Yeah.
Okay.
I wonder if you want to talk about this the sentence in light of the Governor Baker's recommendation to only test if you're symptomatic or a close contact.
I think that'd be good to just update that to reflect what we're seeing from the state level. I mean,
Because I know on a local level, the testing sites, you're getting a lot of appointments due to travel that could otherwise go to someone who's actually sick.
yeah, maybe I feel like maybe we should do that. What do you?
Or add in another paragraph or add in another number if this is still relevant and you don't want to necessarily scratch it.
Well, it seems like.
Yeah, go ahead.
No, go ahead, Ruby.
Oh, I would prefer to keep it. Because so many of us, I feel that the stories I do hear are after gatherings that people have tested positive. So testing right before a gathering can prevent spread. So I still feel that that is relevant. And hopefully we'll get more home tests available in the near future. So it may not take up the test sites that, the very limited number of test sites that we have presently. So I was wondering, there is a website that people can directly log on to if you test positive. Is that true?
A government website or a government or state website, or?
I think it's an app that you can directly go, and it's anonymous, but it just kind of gives a number. I don't know, Rebecca, you know?
I'm blanking on the name of the app, but it's true. 6 months ago, I think the Department of Public Health worked with Google to develop this app that's free. I can't believe I can't think of the name of it. But it is an anonymous detection and notification system. So as a user of this app, you're allowing your phone to kind of like survey when you're near other people. And if somebody also has this app, like you've consented to share this information or have this information on your phone, if both people are using this app and then one person tests positive, the app will send a notification to anybody that was a close contact, meaning less than 6 feet for greater than 15 minutes, to that person saying, hey, you might want to go get a test. You've been identified as a potential close contact. So that's the function of the app, but I can't remember what it's called.
Exposure notifications. It doesn't have a name other than that I can see.
Okay. Do we want to put that in, or do you want to get a little more information about it before we add that in?
Yeah, we're not ready for that, I don't think.
Yeah. Okay.
No.
So sounds like we should just leave it as it is, other than the slight change we made in terms of the masking issue.
There's in number 6.
Oh, I remember what it's called. Mass Notify, like MASS, Massachusetts Notify. So, sorry to interrupt you. It just light bulb.
Okay. Say that again, Peter.
In number 6, we're kind of looking at the health, the lifestyle things that were brought up before. There is an opportunity to put in there, because it talks about mental health and exercise, but it doesn't talk about nutrition, diet, other healthy lifestyle.
Yes.
Things.
I know we talked about this before, and that's kind of what we came up with. But I would be happy to see something to.
It's just another comment, a couple words to
Mhm.
incorporate.
I think that would be great. Yeah. Healthy diet choices or something.
I'm trying, I don't know how to word that in such a way that it doesn't fall into the trap of diet culture jargon.
Oh,
Right. So healthy lifestyle and food choices.
What if you said improve your physical health and well-being? Is that
Well, we've got stuff that general. I was trying to get the food part in there.
and so why can't we say diet, Rebecca? I'm
It's not
unfamiliar.
that you can't say diet. It's just, there's a lot of stigma around dieting and pressure to diet.
Oh, I
And
see.
that's, it's created this diet culture that's maybe not so beneficial to all of the other aspects of public health that we care about.
Right.
And
how about healthy food choices?
Does that fall under that rubric of stigma? Healthy food choices?